My name is Shannon, and I was diagnosed with type 1 diabetes in October of 1992, and this was about a month before my 18th birthday. I was in the hospital for a week, and one conversation that comes to mind is I had the doctor on call that admitted me into the hospital, casually leaned up against the wall and just out of the blue said, "Just so you know, you're never going to be able to have children." And I remember just looking at him thinking, what are you talking about? I didn't have any resources to prove otherwise. This is just, the doctor tells you this and you just have to believe it. But inside I was so crushed because my entire life all I ever wanted to be was a mom. So to have someone just rip that out from underneath me was just, I can't even explain how that made me feel. But I am happy to say that I did prove that doctor wrong. I am now the mom. I had a little boy in 2008 and a very healthy pregnancy, a very healthy delivery. He was born at 38 weeks and he is a thriving 5-year-old little boy. That's actually him making all that noise in the background. And then I also, my husband and I in 2012 decided we just need one more. Let's try for one more baby. And little did we know that we were going to have 2 baby boys. The doctors watched me like a hawk. We went to our first doctor's appointment, and the nurse said, "I definitely see 2 heartbeats. Let's make sure there's not 3." And my husband said, "Yes, let's make sure there's not 3." We did have to have help with both of our pregnancies. As far as I had to see a fertility specialist because I also have something called polycystic ovarian syndrome, PCOS. And that is common in diabetics. It's kind of a chicken or the egg situation. They don't know which one causes which. But I did find out when I was 17 years old, or 18 by then, that I had it, and it does make it more difficult to get pregnant. But the good news is you can get pregnant, and the better news is I had 2 healthy pregnancies, which produced 3 very healthy children. My first son was over 7 pounds. My twin boys, one was 7 pounds 4 ounces, and the other one was 6 pounds. So I had 2 very full-size baby boys in there, and I only gained 24 pounds, which I also happened with the first pregnancy. I only gained 17. So you don't have to gain a ton of weight. When some women are pregnant, they gorge on anything they can eat because they're eating for 2 or 3. I didn't have the option to do that. Because I wanted to take my diabetes very seriously while I was pregnant both times. This most recent pregnancy, I was in a doctor's office at least once a week. I was in a doctor's office at least once a week towards the end. And with the twins, they did deliver me at 36 weeks and 5 days. And that was because my blood pressure had started to creep up a little bit, and I was swelling, which is basically preeclampsia. But they took them both. I had a doctor's appointment on a Friday, and she said, "Well, let's see you Monday and see how your blood pressures are looking." I went in on Monday, and she said we were taking the boys tomorrow because my blood pressures had started to creep up, and I had a rash called PUPS rash, which was the worst part of the entire pregnancy. It wasn't related to diabetes, though. It was because it's common in pregnancies with multiples. So we had the baby boys on a Tuesday morning, and they took me back for surgery, and there was a planned C-section. They both came out perfectly fine. Baby B did have some tone issues, so if you picked his arm up, his arm would drop. And his blood sugar was pretty low. It was in the 50s, I believe. And so they kept him in NICU for 4 or 5 hours. But then after that, they brought him to me, and everybody was happy and healthy. I was in the hospital for 4 nights. My blood sugars crashed pretty drastically by the 2nd night. Because when you're pregnant, your placenta produces an insulin-resistant hormone. So by the end of both of my pregnancies, I was taking 3 times the amount of insulin that I had been taking when I got pregnant. And that takes a while to go back down to normal. So by the 2nd or 3rd night of being in the hospital, my blood sugars just out of the blue were dropped in the 40s and 50s, if not lower. So my husband quickly found out where the snack room was, and we'd keep peanut butter crackers and juice by my bed every night. Because I would just wake up in a cold sweat or a clammy sweat, and we'd get that and that'd be fine. But then it would drop again a few hours later, just completely out of nowhere. So it took about 2 months to get them back to normal. But they are now a little over 3 months, and they're doing great. We're all healthy. I'm back to my pre-pregnancy basal rates. And so the purpose of this video is just to let you know that you can get pregnant, you can have a healthy pregnancy. You have to do a lot of legwork in the beginning, and it's a lot of effort. It's not easy. I'd be lying if I told you it was easy. You've got to put in effort ahead of time. Your A1Cs need to be in a good range. You've got to, they say statistically, I believe I've heard that you need to be healthy in good A1C range for at least a year before you get pregnant, for your sake as well as the baby's, because if you're not healthy, you can't have a healthy baby. So my doctor said that she wouldn't feel comfortable with the patient getting pregnant if they were above a 9. To me, that's a little high. I was in the 6s and like 7, low 7s, I think, when I actually got pregnant, and now I'm back in the low 6s. So it can happen. I wish I had an opportunity to have tools like this, to have friends, to have just the online tools available. When I first had that horrible conversation with that doctor that told me I would never have a child, because it was a very hopeless feeling, and now I know that I can. I have. We are done now. It's not worth it to try again, in my opinion. But to know that you can do it, and I wear this bracelet every day that I got from the You Could Do This booth from Kim, and it reminds me that I can do this, and I did do this. And you know what? So can you. Thanks.